There is a new procedure, and this is called iTind, and it can help men with this problem improve that quality of life. What is this procedure?
Yeah, iTind is a stent so that we put in the prostate so that it opens the outlet of the bladder. Basically, what happens when we grow men, we have a prostate that is sitting right outside of the bladder. So in order for the bladder to empty, we have to push, the bladder pushes and passes through the prostate and outside, right? When the prostate starts growing with age, this compresses the outlet and we have to open it. And the stent, basically, that's what it does. It opens it, and it avoids some of the complications or some of the side effects that can come with the more classic options that we have, right? And the nice thing is it's a temporary stent. We don't leave anything inside, and it doesn't really affect the sexual life of the patients, which can be affected by the other methods.
How is that? I'm sorry, I'm just going to go off script a little bit because that was so interesting to me that it's temporary.
Yes.
How does but it continues to work after?
Yeah, so we have long-term data to about 3 years and showing that the effect of the stent actually stays, right? So that's great. And it's a nice thing because it takes like 15 minutes to put it on, and it opens the prostate. We leave it there for 1 week, and it does its job. It basically opens the prostate, cuts a little bit in 3 pieces, and we remove it in the clinic. It takes a couple minutes to remove it in the clinic. And nothing stays inside, and the patients can void, can pee without much difficulties.
That sounds too good to be true.
Yeah, I know.
15-minute procedure and keeping it in only a week. So let's talk about the recovery and the benefits, because this is really minimally invasive.
Yeah, it's great. I mean, as I said, we don't leave anything inside, and when we put it, the patients will feel some pressure during that week because it's sitting there in the prostate.
Sure.
So when they sit down, they will feel that. They might feel like they have to go very often to pee, but it's just during that week. And then we remove it, and they go back to normal life. Like they almost like they forgot how it was to pee normally, right? So it's a really nice procedure, and with hardly any side effects for it.
What kind of outcomes then have you seen?
So patients have done great. Like we started doing this recently here in Penn State. It's the first place in Pennsylvania where we are doing it, and the patients have done great. After we remove it, all of them have been catheter free, so they no longer need a catheter to drain the bladder. Right? Many of these men already have so much trouble that they can't empty the bladder and they have to put a catheter in. After these, we leave them without the catheter, and the follow-up has been great. And as I said, there's no effect on quality of life, no effect on sexual life, and which it's important because more and more this is being done in younger men, right? Okay. Because and even older men, they have a better quality of life than they had a long time ago. So this is adaptation to the new demographics that we're looking at.
It sounds like such an opportunity. And as I mentioned earlier, sometimes men are hesitant to go to the doctor. Now, if they're having an issue right now with their prostate, this may be a reason for them to come in and talk to you. They might be like, okay, I can handle this. So if somebody comes in for an appointment, what can they expect?
So we talk about the symptoms, right? We ask how are they feeling, how are they voiding, if they wake up at night, if they go very often during the day, if they have used any other treatments before. And usually I like to do a cystoscopy and an ultrasound to know a little bit about the anatomy, the shape of the prostate, how big it is, and make sure that the iTind is going to do the work, or if we need to do any other kind of therapies. But we usually do that in the clinic. The cystoscopies take a couple minutes, the ultrasound as well. So it's a very straightforward visit. And after that, we just plan, and we go over the details. We'll go over the follow-up and the expected outcomes during the week, and that's it.
This iTind procedure, I just find it remarkable, and it's fairly new. I mean, it's just at Hershey right now, right? So when patients come in and you tell them that this is an option, do they have the same reaction as I do?
Absolutely. Like most men think that we have to remove the prostate, they have to stay in the hospital for a couple of days with a catheter, flushing the bladder, all those things that are the classic idea, what we know and the patients have heard from other people. So when they come and we say, hey, we're just going to go in, we're going to do a cystoscopy, put the stent, leave it there, a string hanging from the penis, a string that we use to pull it out afterwards, and that's it. And they're very surprised. And, you know, after we remove it, patients have been very happy. So that's the most important thing.
What a dramatic and easy improvement to quality of life.